you for returning promptly, and we're going to move into our public comment period. I'll just remind folks that the people who are going to speak have registered in advance. We'll be using Zoom to try to keep everyone to the 3-minute time limit. We'll ask speakers to unmute themselves when it's their turn and mute them when their turn is up. We need to be strict with the 3-minute time limit to hear from as many people as possible. We also encourage all of you and any of you to send any written material that's relevant to our charge to the National Academies staff. Be sure to include your name and contact information on any written materials you provide. All testimony in an open meeting and all materials provided here are a matter of public record and are able for other members of the public to see, as well as the committee. And the information on this, our statement of task, a kind of an introductory video, are all available at the NAS website. So I'm going to get started, and I have a list that's an in-order list, and we're all looking forward to hearing from each of you. And I'm going to start with Beth Marcusino.
Hi, can you hear me?
Yes.
Okay. So my name is Beth Marcusino, and I'm a mother, a wife, and a community activist. Thank you so much for allowing me this time to speak. Myself and many others question if our health problems are associated with PFAS in our environment. Within the last 5 years, my life has been flipped upside down. I did all of the things that you're supposed to do. I exercised, ate healthy, and drank plenty of water. I never questioned the quality of my water or if my food was contaminated. In 2016, I became pregnant with my second child, a boy named Samuel. I thought he would be born healthy like my daughter, but he didn't. At around 20 weeks of pregnancy, I felt a sharp pain in my stomach and ended up going to my OBGYN. It was there that I learned that Samuel had next to no amniotic fluid. They then rushed me to the hospital. At the hospital, we learned that Samuel also did not develop his kidneys, bladder, or bowel. The hospital put me on bed rest and pumped me full of water. I can still remember the mauve pitcher that they would pour the water. Not in a million years did I think that the water that they were giving me was toxic or harming my son. It was 2 weeks later that we went to Duke, and the doctors also told me I had placenta pruriba. She told me Samuel was dying and that I had to give birth to him via cesarean. It was then that we went to Michigan with my family so I could give birth. We all held my son, baptized him, and he died. It was months later that we learned for the first time of the Gen X contamination. I would love to say my health problems have ended, but they haven't. I started developing cysts on my ovaries the size of oranges. Even after my doctor would remove them, they would grow back. I had to have a full hysterectomy at the age of 38. From then on, my health continued to decline. Even though I was exercising, I was gaining weight, and I was tired all the time. And my body, it really feels sick. I went for testing and found out I have an adrenal tumor, cysts on my thyroid and my parathyroid, high cholesterol, I'm pre-diabetic, I'm deficient in vitamin D, and I just recently had to have my gallbladder removed. I don't know what all of this means, but I do know that I am part of the Gen X study, and I have multiple PFAS in my blood. I know that there are PFAS studies that list thyroid disease, high cholesterol, endocrine problems, and pregnancy loss as health effects. I know that I am not the only one in my community that has had health effects associated with PFAS. And these chemicals, they scare me, and they scare my community too. Thank you.
Thank you, Marcusino, so much for sharing your story with us today. I would like to turn now to Diane Cotter.
Everyone for allowing this opportunity. I'll be as my husband, Lieutenant Paul Cotter, retired firefighter from Worcester, Massachusetts, was medically retired from his career. We now serve as advocates that are seeking to elevate our community of firefighters in that PFAS exposure. Hundreds of studies on firefighter turnout gear, but not one study produced the knowledge of what turnout gear. We took on industry and labor to find the truth ourselves as manufacturers us to swallow. In June of 2019, Dr. Graham Peasley, Notre Dame nuclear physicist, published used to make turnout gear. In the years leading up to this study, it became clear to us that medical monitoring and health studies needed to provide a bare minimum toolkit of the exposures they fear, now known as the most highly fluorinated textile ever to be seen by nuclear physicist Dr. Graham Peasley, or their AFFF exposures. As leaders in the national, we hear our allies testing outcomes, and we're not having those discussions with firefighters. What makes the fire service as a separate groups by both federal and state organizations.
Diane, I'm afraid we're missing like every third or fourth word. I wonder if you could sign out and sign back in, and then
Sure. Sure.
I'm so sorry.
No worries at all.
I did see Andrea Amico.
Hi there, can you hear me okay? Great,
Yes,
thank you.
you sound good.
Good evening. Thank you to the National Academy for hosting this town hall, and thank you to my fellow PFAS community colleagues for sharing your personal and heartbreaking stories. My name is Andrea Amico. I'm from Portsmouth, New Hampshire, and my family's been directly impacted by PFAS contamination from contaminated drinking water at the former Pease Air Force Base. When I first learned of my family's exposure, my heart sank. I immediately worried about the health of my young children, who were and still are in critical stages of their development. I worry that these forever chemicals will impact them not only today, but for years to come as they grow and become teenagers, young adults, and beyond. My community has been incredibly fortunate to have access to PFAS blood testing and to 2 PFAS health studies, yet I still don't have clear-cut answers as to what I can do to monitor my children's health today as they continue to grow. There has been a significant lack of leadership and guidance at the federal, regional, and state level to create clear, accurate, concise guidelines to physicians on how they can help. The go-to expert in Region 1, where I live, has minimized community concerns, undermined and discredited the science, and has told impacted community members not to worry and not to do anything different other than their annual wellness checks. That is dangerous, given what we know about PFAS and the multiple impacts these chemicals can have on the human body. As we wait for our leaders to analyze science and debate if there's enough information to set guidelines, families like mine wait in the wings with no guidance and pray that our loved ones don't get sick. Every time my children experience illness, my head goes to the worst place, and I worry that exposure to toxic chemicals as babies and toddlers will follow my kids throughout their whole life, causing adverse health effects. While we still have so much to learn about PFAS, the reality is we know enough to make guidance and recommendations today. I would like to see recommendations to allow PFAS blood testing for anyone who wants it. I'd like to see guidance on blood work that can be done regularly to check kidney, liver, thyroid, uric acid, immune function, and more. And we need better physician education starting at the medical school level and beyond that places more emphasis on environmental exposure and impacts to public health so patients don't end up being more knowledgeable than the very providers they go to for answers. Please keep in mind that communities had no choice or control in our exposure. We have been contaminated without consent and poisoned without permission. I can't undo what has been done to my family, but the one thing I should be able to do, the one thing I should be able to control is the action I can take moving forward once I know my family's been exposed. Unfortunately, the action communities can take is incredibly limited because we lack guidance on how to monitor our health. Our physicians don't know what PFAS are, and we cannot easily obtain blood testing. PFAS may have been given more attention in the last 5 to 10 years, but this is not a new reality. The reality is communities have been exposed to a mixture of PFAS for decades and some families for generations. We need help now. We cannot wait anymore. Please listen to all these community groups and help recommend the guidance we so desperately need. Thank you so much.
I'd like to turn to Javita Lee.
So I am Javita Lee. I am the Vice President for the Board of Democracy Green. I'm also Policy Support for North Carolina Black Alliance and Professor of Sociology at Meredith College. Both Democracy Green and NC Black Alliance are co-petitioners seeking reconsideration of a PFAS and a 1,4-dioxane petition submitted to the EPA. So as many have already stated, PFAS are highly dangerous and man-made chemicals, also known as forever chemicals, that enter the body via environment and consumption. These chemicals have been wreaking havoc in North Carolina communities for decades and can be regularly found in heavily utilized items like Teflon pans, clothing, firefighting foams, food packaging, and all of the items that have been listed thus far from our speakers today. These chemicals have an enormous human impact, especially pertaining to Black and Brown communities who have the highest rates of cancer, hypertension, and respiratory illness. These chemicals have entered the body in various ways, one of the most common being water. The water supply, including private wells, has been severely compromised, forcing alternatives to the forefront. But it is imperative that we also take a deeper look at and reiterate the cumulative impact of this crisis, especially in the state of North Carolina. The groundwater contamination that we're seeing from these chemicals, thanks to the behavior of hemorrhoids, is only layering onto the groundwater and soil contamination that we are already facing due to K4 operations due to Smithfield Foods, which is located in the eastern portion of our state, which has only been exacerbated by our severe flooding from 500-year storms that we're facing every 2 or so years in this state. And these facilities are residing on floodplains within our state, adding to the risk and the exposure coming through the flood waters that we face. And not only that, we're coming up on the annual Black Maternal Health Week, where organizations are going to be hyper-focused on closing the gaps in equity between Black and Brown mothers and non-Black mothers in regards to breastfeeding. This includes training, this includes advocacy for mothers, specifically Black mothers, to be able to breastfeed. But how can we honestly promote that narrative when here in North Carolina, we know that there's an additional risk that mothers have to accept, essentially, because we're adding to the plate this high risk of these chemicals coming through the breast milk of mothers. And so we already see high rates of risk and complications and even death, especially in the reality of Black and Brown mothers. But we are asking them to essentially take on this risk in addition to what is already being faced. So there are several aspects of this to unpack, including our storms, our food packaging, our water supply, maternal health, to name a few. And it's my hope that we start to prioritize additional research and access to proper testing for communities who deserve to know more about what is actually entering their bodies and what is actually going to impact their livelihood for years to come. Thank you.
Thank you so much, Jovita. Appreciate your testimony. I'm going to go to, I would like to go back to Diane Cotter, because I see you're back on. And could we try again?
Thanks, Ned. I won't reread anything, but I do want to just show you some of the numbers from our study with nuclear physicist Graham Peasley. And what he did was he studied about 20 years worth of turnout gear, both new and decommissioned. And I just want to call to your attention that a 2017 brand new moisture barrier had 90,400 parts per billion of PFBS. I think that is shocking. And the word that we need to get to the fire service is that you are handling it. It is coming off in your hands. We need this we need strong language for our fire across the board, no matter if they're call or municipal or Department of Defense firefighters, about handling the turnout gear. We're also seeing that in a brand new thermal layer, that's another component of the turnout gear, there was 77 parts per billion of PFOA, and that was in a 2008 set of gear. It's a very complex issue within the fire service because the gear has to last 10 years, but what's happening is it is shedding and it is coming off into the wastewater systems, and it's really become quite an issue for the leachate, as well as these will all be end up in the landfills. I also want to talk quickly, if I can, about firefighter blood drives. Somebody has to be looking at that, because that is a concern that we have. Our firefighters do have 2 to 4 times the national average of high levels of PFAS. In my written comment, I provided a number of documents for your studies, and I think that we just want to remind our firefighters that every time they don their gear, they should be logging that as an exposure, because it is easily transferred onto their hands as they touch their gear. Thank you for the opportunity. Thank you for the ability to work with you.
Thanks so much, Diane, and I appreciate you working around the technology, and I'm glad it worked.
Thank you.
For you could provide us that important statement. I would like to turn now to Sanja Whittington.
Hello, my name is Sonia Whittington, Executive Director of Democracy Green, an environmental democracy organization and co-petitioner in the recent PFAS petition to the EPA. It is great to see our fellow co-petitioners and fellow North Carolinians speaking on this panel today. I want to thank each and every one for their transparency, strength, and bravery in elevating such a horrific journey that many of you have been on. As a native of North Carolina, I am proud to see North Carolina represented, especially the Black and Brown communities. Because Black and Brown communities are undercounted, this allows corporations to move into these vulnerable neighborhoods and operate. As mentioned, our communities are exposed to these contaminants through layers of industry and common household products. The absence of labor rights in an employment at will state, employers are opting to hire our community members as contractors. This eliminates the hope of adequate health care coverage across the state for many families in these communities. We need all the testing and clinical guidelines that are available, just to begin giving our people options at recovery. We need clinical studies to include the populations Lamicia mentioned. Instead of milling each chemical, PFAS must be tested and considered a class. Our communities are not only exposed at work, but at home, by way of carpets and other goods, through air emissions, through rural and public utilities, at our schools, through our water fountains. Because Black and Brown communities are undercounted, equitable outreach in these areas also suffer. So when testing begins to occur, it is crucial that Black and Brown community leaders across the state be involved with community recommendations. Some folks displaced by Hurricane Florence and other hurricanes have moved to the mountains of North Carolina. How are we providing support for these now displaced Eastern North Carolina communities to access testing opportunities, to guide in these studies? I want to thank you for this town hall, and I want to thank you for this opportunity. Thank you.
Thanks so much, Sonia, and I apologize for mispronouncing your name. But it was really strong and a great comment. I appreciate it. I would like to now turn to Yolanda Taylor.
Good evening, everyone. My name is Yolanda Taylor. I'm an attorney at law. I specialize in the area of housing and health equity. I'm also the program attorney for Advanced Carolina, and I'm an adjunct professor of law at Wake Forest University School of Law in Winston-Salem, North Carolina. I also consider myself to be a health equity worker. Why am I a health equity worker? Because I believe that where you live matters, and where you live determines a number of things, including your health. I believe in health equity, which is that all people should have an opportunity to reach their highest health potential. We know that the so-called social determinants of health can lead to disparities in health outcomes. A health disparity is really a health inequity if you examine the root causes of such health disparities. It appears that that Black and Brown communities are mostly impacted by PFAS, and not just Black and Brown communities. I've heard a lot from rural communities as well. But as it relates in particularly to Black and Brown communities, we understand that they are always disproportionately impacted by certain health, by pollution, environmental pollutions, and apparently PFAS as well. So speaking specifically about Black and Brown communities that are often lower wealth, these are the communities where I spend most of my resources as an attorney. We know that the lack of access to grocery stores, but having a surplus of fast food restaurants that contain this contaminating packaging is a health issue and a health inequity. So there needs to be an intentional plan, I feel, if it hasn't already been, to outreach specifically to these communities and educate them, because it's probably certain that a lot of residents in these communities are unsuspecting of this contaminant while they're being disproportionately impacted. Also, the Union of Concerned Scientists have stated that PFAC's contamination is an equity issue. In their analysis report entitled Abandoned Science, Broken Promises, they found that communities of color and lower wealth communities are more likely to bear the economic and biological burden of the federal government's lack of responsiveness to community concerns on this toxic class of chemicals. So it seems like Michigan is one of the few states that have created this system, a systemic way of being able to test for this chemical. So one of the things is that I'm glad that North Carolina definitely made comments tonight. And as you can tell from the panelists' own testimonies and own lived experiences, that this contaminant is ever so present in North Carolina and apparently South Carolina as well. So my comments are mainly that all people, despite of where they live, they should have an opportunity, again, to achieve their highest health potential and have accessible, clean, and safe drinking water. Thank you.
Thank you very much, Yolanda. Appreciate your time and your thoughtfulness and your comment today. Next, I have Meg Seymour.
Thank you. I was muted for a moment. So thank you so much for the opportunity to speak today on behalf of the National Center for Health Research. I'm Dr. Meg Seymour, a senior fellow at the center. Our center is a nonprofit public health think tank that analyzes and explains scientific and medical information pertaining to the safety and effectiveness of consumer products, medical products, and exposures in the environment in order to improve policies, programs, services, and products. We do not accept funding from companies that make the products that we evaluate. We appreciate today's excellent forum about PFAS research. Exposure to PFAS and its subsequent health effects are a great concern to our think tank as well. As you heard today, many communities are affected by PFAS exposure, and measuring PFAS levels in the blood can help to properly diagnose medical conditions and urgently reduce the riskiest exposures. Although it is not yet clear exactly how information about PFAS exposure could best be used to improve public health in all cases, the need for substantial research is clear. In addition to testing those most likely to be exposed at work, such as firefighters or those working in factories involving PFAS chemicals. We need testing in communities with PFAS in the groundwater, near landfills, near contaminated agricultural fields, or exposed to contaminated seafood or other contaminated types of food. And we also need baseline data for all children and adults living in areas that represent the country as a whole. We also ask you to consider the potential impact of exposure to artificial turf and playground surfaces that contain PFAS. Athletes and children who play on artificial turf may be exposed to PFAS for hours every day. In addition, these materials eventually end up in landfills in many parts of the country. Further, PFAS can present a particular risk for pregnant and lactating women, such as increasing the likelihood of developing preeclampsia or lower birth weight. Low birth weight can cause subsequent harm to the child. A 2019 study published in the Lancet Planetary Health found that higher exposure to PFAS during gestation and early life can lead to reduced lung function in children. For these reasons, pregnant and lactating women across the country should be tested. Although it is impossible to entirely avoid PFAS in one's environment, we urge that clinicians advise patients on how to reduce their exposure in their homes and their communities. Thank you.
Thanks so much, Meg. And we appreciate your advice and comment. Just great. I think next I have Katie Bryant.
Thank you for having me. I'm the founder of an advocacy group in North Carolina called Clean Haw River. It's in Pittsburgh, North Carolina, and we're actually a small town made up of roughly 4,200 water users, and we're projected to grow to nearly 60,000 in 30 years. So I'm here speaking for everybody included in that growth. Our main source of drinking water is drawn from the Haw River, which has a long history of being polluted by upstream textile industry and land sludge application. In fact, if you go downtown and ask anybody from here, they will tell you, do not drink the water. They know that their water is bad. If you go to anybody that's been here for a very long time, they'll tell you that it used to come out of their tap in different colors based on what the textile industry was doing upstream, which should be alarming. In a recent study conducted by Duke University, Pittsburgh blood samples, including my own, maintained higher than national averages. Currently, the health advisory limit of 70 parts per trillion for PFAS and PFOA simply don't apply to our population. When any given day our water exceeds those limits. In 2018, NC State found that our water levels collectively for PFAS were about 1,000 parts per trillion. This is a list I've compiled from people in my community and what they're suffering from. Digestive issues, irritable bowel syndrome, failed gallbladders, high cholesterol, thyroid disease, dermatological disorders, infertility, pregnancy complications, miscarriage, low birth weight, high maternal weight, developmental delays in their children, sensory processing disorder, learning disabilities, and additionally, we have many, many, many on kidney dialysis that's not getting any attention. And we have noted reoccurring cancers and very rare cancers. All of this is of huge concern to me because most of the local population already predisposed to these diseases are not being warned or given proper guidance to safeguard themselves or their families. Just eliminating our main water source, having that directive given to them, could help improve their daily life, could get off medications, or maybe even slow the progression of their diseases. I believe our local medical health professionals are at a huge disadvantage. They don't know very, very much about our water crisis and have no real advice when they're approached. They're lacking just as much as our community. They need solid protocols, regular training. They need to offer health screening assessments to contaminated communities and be actually asking the people, what are you drinking, how much, how frequently, and what are your professions? I feel that once the water source is confirmed, they should then order blood serum tests regularly for these patients, especially when they're presenting with any of these complications. I feel that all of these patients should then be provided a handout regarding their water, potential risks when drinking it without a filter, and additionally, they should be educated on typical routes of exposure to reduce any further exposure, such as food packaging, carpeting, and nonstick pans. This is especially critical for our town because we still don't have any sort of resolution and we're waiting, and I have no idea how long that wait is going to be. Thank you.
Thanks so much, Ms. Bryant. And let me pause and thank everyone who signed up to provide a personal testimony and a comment during this open public comment session. And again, to thank everyone still on the call who participated in the panels. This issue really requires that we are able to hear and think about and bring in the lived experiences and information and stories from people who have faced the contamination in their communities, have seen the impacts that are associated with the issues, and I really appreciate the thoughtful advice that folks have provided. There are some clear themes that have evolved. This is our first, let's say, second meeting, but our first kind of town hall. We'll do another one in kind of the middle of the country and another in the west, so that we're trying to be inclusive across the country of registering the information that individuals have and the stories that they can bring to the committee for us to think about and to use as we sift through the evidence and craft a recommendation. Sorry, let me say sift through the other evidence and craft a recommendation. So I appreciate all your time. I have to really appreciate the committee members who've been through here with us the whole day, listened carefully, asked really good questions, and have been engaged. And then, of course, I always feel it necessary to thank the staff, without whom putting together even a Zoom call, something as complicated as this, it's just such a huge effort. So Elizabeth and Kaylee and everyone else who participated, thanks. And then I think he's still on. I don't see him, but our Zoom expert who kept us moving along, and Quinn, there I see you are. Thanks. I appreciate everyone, and we're only about 5 or 6 minutes over, so I'm going to let everyone go unless, Elizabeth, you have a final comment, as I see you've unmuted.
No, I just thanks everyone, and that was a great closing, Ned.
All right, I will see the committee at the next meeting, and we look forward to any written materials you share with us. Thank you so much.